Hello and welcome to Life with Dr. Amanda. I'm Dr. Amanda and it's time for another Medicine Monday, where the aim is to educate, empower and equip you with the knowledge that you need to live your healthiest life. Today we're talking all about acid reflux. So today is acid reflux, and I've been asked by quite a few people to do a video all about this. And it's no surprise because although 1 in 10 people actually struggle with acid reflux, it's something that loads of us have experienced before. So acid reflux can manifest itself in a number of different ways. Some people will struggle with heartburn and indigestion type of feelings, and some people with just a bit of pain at the top of the stomach. Others may have this irritable, persistent cough because of the acid irritating the back of the throat. Nausea is another symptom, and also a very horrible, hot, soury, salty taste at the back of the throat as well. Early in the morning, a lot of people do complain about this increased amount of saliva, something that we call water brash. And then there's also the belching and gas and wind and bloating that comes along with it too. Now, although the majority of people that have these problems with acid reflux, it'll be something that is completely benign, it's very important that we do manage it, because if it remains untreated properly, then you'll just be uncomfortable a lot of the time. But in the worst case scenario, that acid going into your food pipe can start to cause problems later down the line. Although most, like I said, are benign, there are some cases of acid reflux that really do indicate something more serious or sinister might be going along. And that's if your acid reflux is accompanied with something called a red flag symptom. I've mentioned it before, but it's basically some symptoms that we can't just ignore, that really need further investigation and can sometimes indicate something scary like cancer. So let me take you through those red flag symptoms before we move on to how to manage those more simple cases of acid reflux. So we have unintentional weight loss, anemia, especially caused by low iron, difficulty swallowing, especially if any food or liquids are getting stuck in the throat, if you're having persistent vomiting as well, and if there's any blood in the vomit or in your stools. Now, blood in the vomit can sometimes look like ground up pieces of coffee, and in the stools, especially when it's been digested, we actually get a different type of stool, which we call melena, which is this dark, black, tarry, sticky type of stool. Also, having a mass in the top part of your stomach is another red flag symptom. And finally, if you're over the age of 55 and you've got new acid reflux that is unexplained and persistent, that's definitely a reason to have more investigations and not just treat it with some of the more simpler things I'll mention now. So managing acid reflux really does start in the kitchen, and so you're joining me at my dining table for a bit of dinner. However, to completely understand acid reflux and be able to manage it best, it's really important we do a little bit of anatomy. So we have something called our food pipe or our esophagus, which is a pipe that takes food from our mouth down into our stomach. When the food pipe connects to the stomach, which just sits right around here, there's a band of muscle there, and that band of muscle is called the sphincter. What it does is it allows food in when it needs to go in, but it also closes quite tightly and stops any contents of the stomach travelling into the food pipe when it's not the time to be doing that. Now, what happens in acid reflux is that sphincter, that circular tube of muscle, is a bit more relaxed. So what happens in acid reflux is that sphincter isn't working as well as it should be. It's opening up when it shouldn't be, and it's allowing the contents of the stomach to go up into the food pipe. Now, the contents of the stomach isn't just what you've eaten. There's actually a lot of stomach acid that sits in there. And although the stomach is well equipped for dealing with stomach acid, the rest of the body really is not. And so it causes a lot of irritation if that acid starts to build up and come up into the esophagus. Now, for the food to be digested in the stomach isn't a bag that just stays still. It actually has a lot of muscular movements and contractions to allow digestion. And so with all those movements and contractions, if the sphincter doesn't stay shut, all the contents of the stomach will start to bubble up and come into the food pipe. Now, there's quite a few things that can make the sphincter more relaxed than it should be, and understanding those things help us to know how we can manage it. So let's start. First of all, if you're obese, if you're overweight, and especially if you're carrying a lot of your weight around your stomach, it can actually put pressure on the stomach, especially when eating, and open up that sphincter when it shouldn't be. And so that can cause some reflux. So the first thing to really do if you are overweight and you're struggling with heartburn or acid reflux, or any of the symptoms I spoke about before, is to try to lose some weight. Secondly, we have smoking. Smoking has lots of bad chemicals in there, and there are so many reasons why you should really quit, but this is another one. Smoking can actually relax the sphincter, and so it allows contents to come up into the food pipe as well. So quitting smoking is always a good idea. Also, stress. I did a whole video earlier on about the physical effects of stress, and I will link that, I think, around here. But one of the physical symptoms of stress can be acid reflux, and that's because stress reduces something called prostaglandins that are in our body and help protect the stomach. And so with that reduction, because of how stressed you are, that can cause acid reflux as well. And so trying to do those relaxation things and trying to manage stress, and you can see all about that in my stress videos, can really help with acid reflux as well. But let's move on to some of the things that you do inside your kitchen that can help you manage acid reflux. The first thing is cutting down on greasy, oily, fried foods. The reason for that is that these foods don't allow the sphincter to close properly, leading to that reflux of acid. So let's get rid of that. These other things here are things that can actually cause a sphincter to open. And that's too much caffeine, which isn't just in coffee, but can be found in fizzy drinks and some teas as well. Too much alcohol, and too much spicy food. All of these things can open up that sphincter and lead to those problems that we can all experience. Cutting down those things are really, really important. The next thing that can cause acid reflux, and we should have a look at, is the size of our meals. If we're overeating and having huge portions, it puts a lot of pressure on the stomach. If the stomach is overfull, the sphincter has a hard time at closing. And so rather than having a huge portion like this, try switching it out for something smaller and having regular meals throughout the day. So some people who really struggle with acid reflux, rather than having 3 meals a day, you might want to have up to 6 of the much smaller portion. It's also important to think about the time of day that you're eating. Now, something that can make acid reflux much worse is when you are lying down. Because as you can imagine, when you're sitting up and walking around going about your day, your stomach has to fight against gravity. And so it's much harder for the contents of the stomach to go up into the esophagus when you're upright. However, when you're lying down at night, that gravity is taken away, and so the food can start to trickle up into the food pipe once again. Now, the best ways to manage that are to stop eating at a certain time, usually about 2 hours before you go to bed, so that you're going to bed on an empty stomach that is less active and less likely to cause you problems and symptoms. The other thing that can help as well, if you really do struggle, is sleeping more on an incline, so that your body's having to fight against gravity as well. So it's not enough just to prop your head up, it really has to be everything from the waist upwards. And so you might want to do that by propping the feet of the bed up, or propping up something behind the mattress, or using a wedge. And the final thing that you can do as well to try and reduce your problems with acid reflux is the speed in which you eat. If you're eating very, very quickly, what can happen is that the sphincter is opening and closing, and it just starts to not behave correctly. And so you've probably had it where you've scoffed down a meal really fast, and then suddenly you've got this horrible indigestion, heartburn feelings all over again. So if you bear with me, I'm just gonna pop and have some dinner and take my time. So now you've done all of these lifestyle changes, and you've thought about these lifestyle measures, changing what you eat, cutting out smoking, losing weight, all of that. There still is more that we can do. Now, for the symptoms that come here and there, and to manage it, say you know that you're gonna have a spicy meal, or you've kind of overindulged a little bit, then there are medicines that you can buy over the counter. And often a really good place to start is going to see your pharmacist and asking for advice. You can take some medications that you can buy yourself with no prescription, such as Gaviscon, Reni, and lots of different antacids as well. But if you're getting persistent symptoms, or you're really at a loss and don't know what to do, coming to your doctor is really important, not just if you have the red flag symptoms. Now, when you come to see me, yes, I will talk to you about the lifestyle changes, but providing that you're doing all those things and you're trying to manage it, there are still more that we can do. First of all, there is something called a PPI. That stands for a protein pump inhibitor. It's a medication that actually reduces and stops the production of stomach acid. Now, that can be very good, especially to use over a 4-week period to see if you can calm things down and get your symptoms settled. Now, if after 4 weeks of that medication, you've stopped it, because really, this medication isn't one that should be like a lifelong thing, but say you use the PPI for 4 weeks and the symptoms return again, there are still more things that we can do. The next, what I do as a GP, is to test you for something called Helicobacter pylori, which is a bacteria that can live in the stomach and can cause these acid reflux type symptoms. Now, this bacteria, is important that we do try to get rid of it, because if it stays for a long period of time, we know that it can increase your risk of stomach cancer. So the way that we can detect if you've got this H. pylori, this bug inside your stomach, is in a number of different ways. There's a breath test that can be done, there's biopsies that can be taken from the stomach, but the simplest way that we usually do in general practice is to take a stool sample. Now, it's very important that when you take the stool sample, the person hasn't been on a PPI for 2 weeks beforehand, but the stool sample is sent off to the lab, and if it comes back with H. pylori, we can eradicate it with a course of antibiotics. It's a 7-day course that you take, and it's usually 2 antibiotics along with a PPI as well. And that usually will stop symptoms and eradicate things. Now, if the symptoms continue and keep coming back, then really at that point, as a GP, I want to know what's going on. Is there something more sinister going on? Is there something that we need to know about? Do you have a hernia, for example? And so at that point, I'll be referring you over to the specialist to usually start off with a camera test, which is called an endoscopy, which is a very thin, probably about the size of your finger, flexible tube that's passed down through the throat into the stomach and to the top part of the intestines, and it can give us a lot of information there as well. If you've had all those things done, you've had the test done, you've had the medication, you've checked for H. pylori and your symptoms are still continuing, it's usually because there is some kind of trigger. So it's about changing those lifestyle things, but also something that's very important is to look at what medications you're on. Some things that you get from the doctor on prescription, but also some things that you can buy yourself. And some things that are very notorious culprits are anti-inflammatory medication. Things like ibuprofen, aspirin, and naproxen. If you're using any of those and you're still getting problems with reflux, then it's really important that you try to cut them out and talk to your doctor about alternatives. There's also a whole host of other medications that can cause issues too. And there are some medications that, because of the benefits it gives you, we can't really get rid of it. And in that case, you may find yourself on a long-term PPI. Now, that was just a bit of acid reflux, a snapshot. But if you are getting persistent symptoms, go ahead and see your GP. But I really hope these tips and tricks have helped. Thank you so much for watching, and if it has helped and you enjoyed, don't forget to subscribe. It's completely free and it really helps the channel. And don't forget to like as well, because the more you like, the more people that can see these videos and get the help that they need as well. Thank you so much for watching, and I'll see you next week. Bye.